I'm Rhonda Crossett. I'm director of the Women's Center at Henry County Medical Center. We are a fabulous place to have your baby or have your GYN procedures. The choices that we have give women options. We have choices in pain control. Of course, we have the common IV medications, the epidurals, but we also have a jacuzzi tub for a low-risk lady to labor in. We do not deliver in them, but you can use that for a pain control method. We also have nitrous oxide use. We were the first hospital in Tennessee to use the nitrous. It's a small hospital. And we have a great food service. We get compliments on our food all the time. Our options for food are fabulous. People say that our food is great. And we have room service where anytime during 7 a.m. and 7 p.m., if you're hungry, you can pick up the phone and call someone who will bring you what you want to order so that you don't have to wait for certain times for the meals to come around. When our moms deliver, they have a choice. Most of those choose dinner for two. It may be steak or chicken cordon bleu, and they can choose their menu. We have several items to choose from, and it will be prepared and brought to their room the night after they have their baby so that they can enjoy a meal with their significant other or whoever they bring to support them during their time in the hospital. We have 10 rooms on our delivery unit, and they are all what are called LDRPs, which means you deliver, you labor, and you recover, and you spend your postpartum time in that room. And that includes if you have a cesarean section. If you have a cesarean section, you would have that in our own surgery suite that's on our floor, and you would recover in your room with your labor and delivery nurses. So you wouldn't have a lot of new people to get used to. You would stay in your room. When you have a vaginal delivery, you have your delivery in your room, and you will stay in that same room until you go home. So there's not a lot of moving your things around, and that is always good. The nurses are fabulous. People compliment often. I get them mentioned by name very frequently, of how well they treated them and how special that they felt while they were at our hospital. And one of the other things that we have is a lactation consultant, a certified lactation consultant, and she has a class and support group every Wednesday at 10 a.m. and she also will come see you while you're in the hospital. We also offer childbirth education. It's a Saturday afternoon class that lasts about 4 hours, and during that class you will not only learn about some things that may be going on in your body that you're wondering what it is during that last trimester of pregnancy, but we do talk about the processes of labor and delivery, and you get a tour of the unit during the class so that you know what to expect, because sometimes alleviating fear is one of the best ways of pain control. Our physicians at Henry County Medical Center are phenomenal. We have 4 OBGYNs that deliver. They're board certified in obstetrics and gynecology, and that is Dr. Paul Locus, Dr. Pam Evans, Dr. Catherine Whitfield, and Dr. Dennis Wieck. And they can take care of your needs. As far as any obstetrical and gynecological, there's few things that they do refer, but most often they can handle your needs as you go along in your pregnancy. In addition, they have Kristian Elliott in the office, which sees some women during their pregnancy. She is a nurse practitioner, and patients come to our unit and just talk about how much they love Kristian and having their experience with Kristian, and she comes and visits them when they deliver. And after you have your baby, the good doesn't stop. We have a pediatric group which sees patients in our hospital, and our pediatricians, we have 3, Dr. Worrell, Dr. Selby, and Dr. Higgins. In addition to nurse practitioner, Heather Larkins. And Heather was a nurse in our unit as she was going to school, so she is very familiar with the newborn and the processes. In our Women's Center, our goal is to give you the best experience delivering your baby and having your family there as possible. We have great security as we now have a locked unit, but we allow you to let your family come in and your visitors come in as you wish to see you, and you make your choices.